Hi, my name is Moses Afolanyi. I'm a medical doctor in Nigeria. Throughout my career as a medical doctor, I've had quite an interesting journey right from when I finished medical school and decided to go into areas in public health, global health, maternal and child health. The philosophy that drew me to high impact medicine is effective altruism. Basically, it's doing the highest good possible. And ideally, as a medical doctor, you are expected to go through the path, which is to have that one-on-one contact with patients within the four walls of a clinic room, which is very beautiful in itself. But high impact medicine has opened my eyes to see that I can contribute very significantly in terms of prevalence, impactful interventions in the lives of people, and also in their health in general. And one of the important projects that I got to take part of due to high impact medicine influence in my career is impacting maternal and child health programs in my state. I had to learn how to collaborate with stakeholders. I learned how to communicate with communities at different level. And then we had this project where we helped over 1,000 pregnant women have access to health insurance, obstetrics and gynecology care. And basically that project led to reducing the maternal mortality rate within my state by about 10 to 15%. And having seen that result, I realized that there is more that can be done by simply going beyond the regular, which is the four corners of the clinic room, into policies, into research, into development, into community mobilization. And also another important project was helping to facilitate the uptake of health insurance in my country. And I learned through that process how to ensure that key stakeholders are being mobilized for such programs. And we're able to improve the uptake of health insurance right about 9.8%, which is very significant. High impact medicine became a very good family where I could not only learn from people, I could also provide myself as a learning box. Educationally, mentally, emotionally, high med was able to build me within that period that the course was being taken. And very carefully, I was taken from 0 to 100 in how I thought about healthcare. And the sessions were carefully structured in such a way that anyone who has never benefited from virtual training now can, because of that structure, because of that organization within the program. And also, another interesting fact is coming in contact with the facilitators themselves. I had my facilitators coming from another country with a different experience. Irrespective of that, I was able to still learn from her very, very, very well. One of the things I also learned was the cross-cultural presence that was happening within my cohort. I had people from different regions, outside of Africa, outside of Europe, exchanging ideas, learning from people, understanding what situations are, and then localizing and implementing those ideas and things that I've learned within the course in my own region. Very drastic, beautiful change in my thought pattern and the things that I could do to provide help to people, to, give back to that same community. Then I opted in to becoming a facilitator on that same program. And it's been a very beautiful journey. Now I'm looking from the lenses of a facilitator, having to take people through that same journey that I was and also delivering the highest impact possible. If you are someone who desires clarity, if you're someone who believes in building relationships, you want to take helping people to the most significant and highest prevalence possible. I remember a mentor of mine saying to me that, Moses, whenever there is clarity, goals get achieved. And so having clarity as to what you want to do or as to what decisions you want to make or what pathways you want to take, I believe that applying to the program with high impact medicine is the best you can do for yourself. One of the beautiful things that I also learned as a facilitator is it cuts across different demography of people. Now, within the cohort that I'm currently facilitating, I have a professor on board. I have a recent medical graduate. I have graduates who have practice experience within 2 to 5 years. And it's so beautiful because you get to see people at different cadres of their works as medics. Don't convince yourself that it's not meant for you. It's meant for medics across different cadres, whether being a professor. I'm sure as a professor, you're looking out to do more things. As a recent medical graduate, you have a lot of questions. A graduate who's had, some level of duration in practice, high med absorbs different cadres of people. And so nothing actually should restrict you from applying or coming on board for the program. Because I took the course with high impact medicine, knowing what next to do is never a problem. So The next thing I intend to do is to learn a bit more. I currently work with the Ministry of Health in my state, closely with the Commissioner for Health, helping grant management and reducing maternal mortality rates, also having impact in communications and infectious disease. So that's what I do now. I intend to go for my master's in health policy and go back a bit to clinical practice and find that integration, that confluence point, and then have much more people significantly affected positively by my journey.